Take it away, Cam.
Right. Do you want me just to launch in, Noreen, or?
Yep, take it away, Cam.
All right. So good morning, everybody. We're not quite to noon yet. So I know you're all trying to think about what your delicious lunch is going to be in about an hour, but hopefully I can distract you from that just for a few minutes and we can talk about Medicare fraud and SMP. And I've been doing this job now for about a year and a half, and I would say I think I've hit the first upper level of the learning curve, but I've got about 25 levels to go. So there's a pretty good learning curve as far as trying to understand all the nuances around healthcare and health insurance fraud. So my goal today is really just to kind of give you a view of what some of these cases look like, what some of the casework aspect might be, and then kind of emphasize the focus of the SMP project, which is for the most part around outreach and education, right? Because if we can prevent the fraud from happening, or we can at least empower beneficiaries to protect themselves to the best of their ability, or to detect it if it does happen, then we've gained a huge amount of ground. It's when it comes out of nowhere and people are surprised by it that it makes the whole process of unwinding that fraud much harder. So what I'm going to do is I'm going to go ahead and see if I can share my slide deck. Give me just a minute here to get it all situated where I want it. Okay, you should be seeing my slide deck there.
Yes, we're seeing it, yep.
Awesome, okay. So Senior Medicare Patrol, just real quick, if there are some of you that really aren't that familiar with SMP, which is what I'll refer to it as, it is a national program. It's in all states and as well as the U.S. territories. And the goal is to empower people, seniors, to prevent healthcare fraud. So our goal is not to run in and rescue or fix issues for people. It's to empower them to know how to protect themselves, how to detect it if it happens, and then where to report it again when it happens. So what do we do, right? What do SMPs do? What's the goal? SMPs are, again, a nationwide program. They are funded by the Department of Health and Human Services, just like our SHIBA programs and MIPA programs. Also through the Administration for Community Living. Some of you might know that as ACL. And we're tasked with, again, I like that word empowering, but also assisting beneficiaries and their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. So it isn't always fraud. Sometimes it's a mistake, a billing mistake. Sometimes it's a beneficiary that's just frustrated because something they thought was going to be covered to a greater extent is not covered as much as they thought, or it's not a covered item. So sometimes it's more a dispute about what's covered or the way a healthcare plan, a health insurance plan administers their benefits. So sometimes there can be a little bit of peeling the onion to figure out what's really going on, and is it really fraud or is it something else? And we do most of our work, again, through outreach, counseling, and education, with a heavy emphasis on the outreach and education. Because if we can help people help themselves first, makes our job a lot easier. And we focus, again, on engaging the community. So just like our SHIBA program, right? SMP is a community-based program. In fact, I like to say it's a community-based advocacy program because we're advocating for beneficiaries, and we're advocating for them to have healthy lives, both in their healthcare, but also in their financial life, in their mental health life, all of the things that fraud can, really interrupt. All right. So what is healthcare fraud? And, I think when this program started many years ago, it was very much focused on Medicare and Medicaid fraud. And it used to be that volunteers were very involved in the investigation part of it, and that's not the case as much anymore. Staff members do more of the investigating, volunteers do more of the outreach and educating and handling what we call basic interactions. So it's kind of more like, think about a scam call. So somebody gets a scam call, the caller said they're from Medicare, they want my Medicare ID number, what do I do? So Tina's gonna tell them, well, stop answering the phone when it's an unknown number. If they say they're from Medicare, hang it up, because Medicare is not going to call you unless you scheduled a call with a representative. And then go visit the Federal Trade Commission website, because they have multiple pages on how to deal with scam calls. And you can also report scam calls through their website. So in that scenario, Tina just did this great education piece for that beneficiary that's wondering about scam calls. So those are the things that our volunteers do. But I've kind of thought over the past year or so that really it's not just Medicare and Medicaid and insurance that we're dealing with. I get a lot of reports that involve healthcare in other ways as well. And sometimes it can center around some malpractice. Sometimes there's issues of neglect or abuse. So sometimes these issues can actually go very deep. And so my knowledge of who our community partners are becomes very important, so that I can make appropriate referrals or I can reach out for help. But essentially, healthcare fraud can be committed by providers, medical office staff. There are medical office staff that are unscrupulous, that may steal people's personal information, patients' personal information, and then sell it. And there's good money for selling people's information to criminal organizations. Medical equipment companies, oh my goodness, fraudulent suppliers are a dime a dozen. And I get to interact with them every day of the week. Yay me. And then there's all other kinds of criminals who are just looking to intentionally deceive the healthcare system, Medicare, Medicaid, and of course, members of the community. So when we're talking about medical provider fraud, sometimes people think that's more about, again, malpractice, but it's not necessarily. And for those of you that have some experience at some point in your life with things like CPT coding, right? So the different codes that offices submit to insurances that say what the procedure was it an office visit, was it a lab test, what it was that the service that was provided. And that's how the insurance company decides what the reimbursement rate is. It depends on the level of complexity and the CPT code is assigned to it. Well, there's rules around these kinds of things, and the CPT coding process is incredibly complicated. There's so many different levels to it. So there can be errors that happen just as a part of human nature, because it's just a lot to keep straight. So a lot of times if somebody reports to me that they think there's double billing going on, which means they see more than one claim on their Medicare summary notice or their explanation of benefits that's the same, I will usually instruct them to call the billing office of that provider, because probably it's just a mistake, but it can at times hedge into the area of fraud. So if that billing person or the provider's office is looking to get double reimbursement, that's where it would cross the level into cross the threshold into fraud. But some of the other things that we see with regard to providers, and keep in mind, when I say providers, it's not just doctors. It can be labs, it can be pharmacies, it can be suppliers, anything that is providing a healthcare service. There can be phantom billing, and this is where something is billed or a claim is submitted for something that the patient never received. And this is probably what we see a lot. It's an item or a service that shows up on somebody's Medicare statement or their insurance statement. They never received it, never saw anybody for it, whatever it is. Unbundling, this is where you think of, like, how many of us go for a CBC lab, right? You go and get a comprehensive blood work done. It's sort of your standard well check, right? The doctor might do it every year. Let's just check your levels. Well, there's multiple tests in that, but it's often billed under one code. So it's a kind of what they would call bundled lab test, but it's reimbursed under one code. Well, if a doctor's office or a pharmacy or a lab or whatever takes that one reimbursement piece and breaks it down into multiple, excuse me, then that is considered unbundling, and that's typically against the rules. And then upcoding. Lots of us have probably heard about upcoding. That's where you go into the emergency room or you go to the doctor's office for an earache, and you find out later that there's a claim, or even they order for you, say, a chest x-ray for pneumonia. So was the chest x-ray warranted? They would have to document in their notes that there is reason to believe a chest x-ray is warranted. Noreen, is there a question that I missed?
Yep, there's a question in the chat. Anya's asking, is it possible to have two separate appropriate bills for one service? Example, one line for the injection service and a second line for the cost of the medication injected.
Yeah.
I've seen this and it seems to be appropriate, no overcharge. Is that wrong?
No, that would be, it depends on what the item is, but yes, that can often be correct. So if you're going into a doctor's office for a Part B injection, you're going to get, you're going to see a charge for the injection and for the service of giving the injection. And then you might also see on your claims the medication, of course, that's associated with the injection. So yes, that would often be appropriate, but it might depend on what it is. So for instance, I think it might be, I could be remembering this wrong, but the pneumococcal injection or the flu injection, Medicare typically will cover, at least I know for the flu, they should not be charging you for that. The service they might charge you, not the injection. So there are some of those that you, if it shows up, let's say it shows up on your Medicare summary notice, I would encourage you to research on Medicare.gov. You can put in what the service is, and it will tell you if that is a reimbursable service, or if it's a service you would pay for or Medicare would pay for. That's a good question, though, because some of those can be confusing. All right. Oh, forward. There we go. So in this case, oops, sorry. In 2024, so what I've done is I'm going to break down these different types of fraud that we often see, and I'll give you a case associated with it so you can kind of think about what this might look like. So in this case of provider fraud, this actually happened here in Eastern Washington. The U.S. State's attorney filed a complaint against a Washington healthcare system, and I'm not going to use any names here, but the healthcare system employed this neurosurgeon. The healthcare system had an incentive program for the volume of surgeries and procedures being done. The neurosurgeon, of course, rising to the occasion, did a huge number, like he was even labeled a workhorse, a huge number of neurosurgeries. And as it turned out, he was providing treatments and diagnoses and surgeries that were unwarranted. So they were false diagnoses, surgeries that were not needed. So people were having these surgeries for no reason, or at least not an appropriate reason. And then, of course, he and the healthcare system were billing these services to Medicare and Medicaid to the tune of $11 million for these false treatments and false diagnoses. So it took what we call a whistleblower. So a couple of patients reported concern about some diagnoses and treatments they had. And there were some internal people also that reported the case to the state's attorney office. Excuse me. They found them guilty. They had to pay more than $1 million back in restitution to the programs. I don't know what the restitution is to the patients because that's not typically disclosed when the DOJ, the Department of Justice, releases information about these kinds of prosecutions. And then the surgeon is excluded from any programs like Medicare, Medicaid, any of those programs for a minimum of 9 years. And so what he would have to do is he would have to come back and request permission to get his license back and to practice as a Medicare or Medicaid provider. He'd have to go through a review, all of these kinds of things. I did not see that there was any jail time served. So I don't know about that, but I know that the restitution did come about, and he, at this point, is not able to continue his license. So then if we move into medical identity theft, oh my goodness, this is probably the number one thing that happens to most people. And this is where your medical information, most of the time it's your insurance ID information. It could include other aspects like Social Security, date of birth, other things, but most of the time it centers around your Medicare ID number. And the reason is that Medicare, good, bad, or otherwise, tends to follow a pattern of pay and chase, which means that they'll pay out for claims that might not be real claims or might be for things that were not ever provided or received, and then try and submit a fraud report to the OIG's, the Office of Inspector General, at a later time and hope to get some restitution for that. The reason is that Medicare being such a huge program, right? They have, millions of beneficiaries in their system. It's very hard for them to stop the way they do their processing, their claims processing, in order to investigate specific claims. And by law, they have to process their claims within, I want to say it's 30 or 60 days. I'd have to go back and look it up. I can't remember, but it's within a certain time frame. So in order for them to stop a claims process to investigate if it's fraud, means that then they risk being outside of those regulations to provide claim reimbursement in a timely manner. So all of that to say, it is a big cash cow for criminal organizations to use somebody's Medicare ID number to bill for things that person never received or the person's not even aware of, right? So some of the things that we do see marketing practices. This is where somebody's going to call you up and they're going to say, gosh, Annette, you have back pain, right? Are you dealing with some arthritis? Did you know that Medicare will pay for you to have a back brace that will fix that arthritis? It's free to you. It's a benefit. And if you could just confirm with me your Medicare ID number and your address, I would be happy to get that out to you right away. Oh, and by the way, what's the name of your doctor? Why do you think they might be calling the doctor or need the doctor's name and number? Anybody have a guess on that one? No. Well, they can send a fax to the doctor's office that says Annette has requested a back brace and is waiting for your order. And a lot of times doctors' offices get busy and they'll approve the order. So they may not have even checked, verified if this is really in Annette's chart. Was there a doctor that saw her for this? Any of those things. I am getting more doctors that catch these, but there are plenty of doctors that approve the order. And now this fake supply company has everything they need to charge all kinds of things to Medicare using Annette's information. And they can even say they had a doctor's approval. So it's easy peasy for them. Identity theft is where somebody is going to use your insurance information and your personal information for financial gain. So again, we just talked about that. But it can also be where somebody goes to a healthcare provider or a supplier, they've stolen your medical identification or information, and they are pretending to be you. And they are now going to get healthcare services using all of your information. And I've had, lately, I've actually had 3 cases where this has happened. One case in particular, the gentleman had over 70 claims in Colorado, which he's never been to Colorado in his life. Emergency room, ambulance, labs, x-rays, hospital stay, private doctors, all of these on his Medicare information. So somebody stole his medical identity, but also his personal identity, and was visiting these providers as if he was this gentleman, this beneficiary. And the difficulty is that when you have that many fraudulent claims or wrong claims, Medicare, as well as Medicare Advantage plans, all kinds of carriers, don't have a great system, nor do they have the capacity to remove all of those claims. So they sit on the person's account. Now, guess what happens if he needs a service in the future that has limited benefit? It might be denied based on a fraudulent claim. So that's a really, really difficult thing for that gentleman to have that many false claims on there, because if something comes up in the future that he actually needs to have, then Medicare might come back and say, well, we've already paid for that for you, and you've used that benefit. The other thing that we're seeing is impersonation. Impersonation scams, that's where, like the example I gave at the beginning, you have people calling and saying, yeah, this is Medicare, and I just want to make sure that Dave's information is all up to date in the Medicare system, and that he has the most up-to-date Medicare card. So can I confirm your information, please? Now, here's a situation that happened. Actually, we'll come to this in a second. I'll give a great example. But this is really difficult because they sound really official, but these criminals also have access to software they can use in their phone bank system that makes it look like they're calling from Medicare. So the caller ID might even say Medicare. The caller ID might have an area code that is exactly the same as yours as the one receiving the call. So that's called spoofing. They can spoof the numbers. It's actually a fake number so that you can't really tell where they're calling from, and it looks legitimate. Remember, Medicare will not call. So here's the example I was talking about just a minute ago with the 70 claims on his Medicare information. And the difficult thing was we called the providers, we called the hospital in Colorado and asked to talk to somebody in their compliance department to let them know somebody was fraudulently posing as this gentleman, and we could never get anybody to give us a call back. So the only other thing left to do for this man, because it was identity theft, was to go submit an identity theft report to the sheriff's office, both in his town, but also in Colorado, and then track it from there. Any questions? Let me stop for a minute. I want to make sure I'm not just kind of buzzing through and ignoring people's comments. And I don't have the chat open, but I can do that. Okay, Nancy says, I thought there was a rule that Medicare must pay within 30 days. Yep, that's what we were just talking about. And how does the criminal get any money for impersonating someone else and generating false claims? It's not that they're getting money. What they're doing is they're getting their services paid for, right? So I had another case where the same thing was happening. And what was scary is that there ended up being a credit report or a collection report against the beneficiary because the person pretending to be her was getting bills and wasn't paying them. And that's attached to her Social Security number. Sorry, I've got allergies today. So I don't know if that was the question, Nancy, that you were asking, or did I misunderstand your question? No, maybe you can let me know as we go along, and I'll keep going, but willing to stop if I need. Excuse me, hopefully my voice won't be scratchy the whole time. Okay, Nancy says that's fine. All right, so durable medical equipment, DME scams. These are a dime a dozen. They seem to kind of ebb and flow, so they go through trends. We're back to a trend where the fake supply company will call first, just like I used in that example, and ask, gosh, you need a back brace, let me send you a back brace. Or they'll call and say, Medicare offers free genetic testing. We can find out if your predisposed to diabetes or cancer or whatever. They'll actually send the supplies sometimes, but the individual may have said no, and also there's no doctor's order for it. So it's all a ruse to get Medicare to pay. So sorry. Some of the things that we've seen in the past that seem to kind of have subsided for now, but I'm sure they'll pop up again, are glucose monitoring. So glucose monitoring, what you'll see on the Medicare summary notice is you'll see a big bill for the piece of equipment to do the glucose monitoring. And then you'll see a monthly bill that's almost the same every bill, for like $600 every month for like 12 months, 18 months, whatever it is. That's for the monitoring piece. And unfortunately, most of us don't check our insurance statements often enough. So when these get reported to me, it's not until those things have been submitted as claims, often, like I said, for like a year, year and a half, 2 years. I had one that was somewhere around $30,000 or more than that, $36,000 for monitoring that went on and on before the person noticed it on their Medicare account. So here's a case. The beneficiaries in Yakima, they noticed the claim, again, for these diabetes supplies and glucose monitoring. So this is, I think this is the case that I'm referring to. These all sit in my head, just so you know. She's not diabetic, not requesting the supplies, right? So she discovers that her Medicare ID has been used for 18 months for these diabetic monitoring, glucose monitoring device and services, up to $30,000. Medicare did put a fraud alert on her account when we reported it to Medicare, but, and she asked for a new Medicare ID number, which she was able to get. The difficulty is, again, it's hard to get those removed off the account once they're there. And then we put together a comprehensive report. And what I do is I send those on to our partners at Administration for Community Living to vet the report, and they refer it on to the Office of Inspector General for further investigation. Medicare card scams. I talked just a minute ago about some of these. Medicare callers are pretending to be from Medicare. They're impersonating Medicare representatives, asking for your ID. I had one lady, this woman was great. She never goes to the doctor. Like literally, she was in her 80s, had had Medicare for a long, long time, never goes to the doctor. So she's got a Medicare card, but she doesn't ever even look at it. So she gets one of these calls and they say, do you know your Medicare ID is expiring? Well, what do you think she sees on her Medicare ID that would make her think it's expiring? Any thoughts?
The effective date?
Yeah, the effective date. So she just saw a date on there and thought, oh my gosh, it expired a long time ago. I can't use it. So they said, oh, great, let's get you a new one. What's the number on your card? What's your address? What's your date of birth? She gave it all out. And, I totally get it because she literally never goes to the doctor. She's super, super healthy. Never even looked at her card, or at least hadn't for a long time, to realize what is the information that's on the card. And she just handed it out like it was nothing. So, there's all kinds of ploys that these people use to get your information. Here's the difficult thing. They'll call, and we are all very compelled to answer our phone when it rings. And we don't, lots of times they'll say unknown number, or it'll say Medicare, or it'll say whatever, and we'll answer it. And as soon as you answer it, your number is now flagged as an active number, and they will now target you over and over and over. So even if a person doesn't give out their information, they are now likely to get 20 calls a day, 30 calls a day for months and months and months. And this is the main reason why I tell people just don't answer those calls that have an unknown number or says Medicare or something you're not familiar with. It's not a common number you would recognize, and it's not a member of your friend or family circle. Don't answer the calls, because as soon as you pick up that phone, they now have you targeted. So here's another example of kind of a serious situation that I dealt with. This gentleman was waiting for approval for cancer treatment. He had been recently diagnosed with cancer, right? So you can imagine his emotional state at the time that this is happening. He's anxious, he's fearful, and he's wanting to get his treatment started as soon as possible. So he's waiting to hear back from the doctor's office and possibly, other callers to let him know that he's all good to go. Well, he receives a call from someone who says they're from Medicare. And his immediate response is to believe it because he's waiting for approval, right? He thinks maybe Medicare would call and tell him he's good to go. But instead, the person that's calling is asking him if his Medicare card is up to date. The caller has no, even though they're a scammer, they have no idea what his personal circumstances are. It just happened to play into it very well. And so the caller is inferring with this gentleman that if it's not up to date, he won't be able to use his benefits anymore. His Medicare won't be good anymore. Well, of course he wants to fix that situation. So he gives the information the caller's asking about. And as soon as he hangs up, he realizes that this was probably a scam call. And then he reaches out to us at SMP. And we were able to go back and call Medicare and get him a new number and get him going on his treatments. But, this is one of those situations where it's bad enough that somebody has to be victimized by these callers, let alone if they're in a scary health situation that they just want to get handled. And then this intrudes into their already fearful situation. So I'm going to take just a minute to kind of share, well, before I go on, the examples I provided of kind of common fraud schemes that we see. Anybody have questions or thoughts? And I am going to, hopefully at the end of my presentation, have a few minutes for you to kind of share any of your stories or ask about, other stories that I might be able to share. But any questions at this point? No, all's quiet. Thanks, Connie. So SMP detective work, what does this look like, right? Well, this looks like somebody calling our helpline at SHIBA or calling the fraud report line with the SMP Resource Center, which is kind of our national head office for SMP, if you want to think of it that way. However they reach out to us, they're submitting a complaint of potential fraud. We try not to assume it's fraud right away, right? We want to get some more information to kind of determine, is this fraud? Is it possible billing error? Is it something else? Maybe it's elder abuse or neglect. It could be all kinds of things. But usually it comes about because somebody has either had an experience that leads them to feel victimized, or they've noticed something on, say, their Medicare summary notice or their explanation of benefits that shouldn't be there. It looks suspicious. Or they've received a package in the mail that they didn't order, right? And they have no reason to believe that they should be receiving, say, back braces or genetic testing or whatever it is. So they're going to call and report this. We take a look at the information they provide. The more information they provide, the easier that process is. But sometimes all we get is a name, a phone number, and I need to report fraud. So whatever information we do get, we kind of review it, take a look at it. Okay, what direction might this go? Kind of formulate some questions we want to ask. And what kind of documents we might need to ask for to verify the situation. Then we give a call to the client or the beneficiary that's called to complain, and we ask them all of our questions. And this includes, here's a tricky thing for us. It includes asking for their Medicare ID number and their date of birth. So now they've gone through a process of possibly being scammed out of these things. And one of the first things I have to ask them for is their Medicare ID information, what their plan, coverages are, and their date of birth. And so I always try and say, if you're uncomfortable giving this, I'm happy to give you the OIC's number and you can call and verify I am who I am. But it's kind of an awkward thing to ask for. But I do have to ask for all of that basic information. And then I have to ask for the details, right? What happened? Or when did you notice that something happened? Who's the entity that is involved? What did you notice about them? So all kinds of different questions about the scenario. Who have you contacted already? Have you called Medicare to report this? Did you call the provider's billing office to see if this was maybe a mistake? So we go through this process. I take a lot of notes, and then I need to ask them, do you have a copy of your Medicare summary notice or your explanation of benefits or the bill statement or the packing slip for the braces that you can either scan and email to me or snail mail to the OIC office, and I can get it that way. So they do have, as much as they are able, if they can provide documentation, we have a much stronger case to forward to the OIG's office for investigation. Without the documentation, it becomes very hard. The other thing I do is once we've kind of done that whole piece of the case interview, I will often refer them to other resources as well. So sometimes I hear from people when they get scam calls, well, I'm on the do not call registry. That's great if somebody is a legitimate business owner, a legitimate provider, whatever. But if you're a criminal, you're probably thinking to yourself, I don't really care if they're on the do not call registry because I'm not interested in following the rules, right? So they're going to call anyway. So I mean, that's great for certain circumstances. It's not going to help you in the case of a scam call. So I will often refer them to the Federal Trade Commission. If you haven't visited their website, I encourage you to do so. They have a ton of great information. And believe it or not, they are the #1 agency to investigate scam calls and robocalls. So even though I can report some of these things to other agencies, like scam calls to other agencies, the FTC is the top agency to do that kind of investigating. I'll refer the person to, again, the provider's office or billing office. If it seems like there's a possibility it could be just a mistake, or it's a dispute, again, that they disagree with the bill that was sent to them. If it's actual identity theft, then there's a couple of things. They need to check all of their bank statements, their financial institutions, like frequently, and put fraud alerts on all their financial institutions. They need to check their credit reporting. They need to put a fraud alert on their Social Security account and their Medicare account. And they need to report identity theft to local law enforcement. They actually are the ones that will take that investigation a little bit further. The Federal Trade Commission has a good webpage about identity theft as well. And then the OIG does take direct reports as well. If somebody reports identity theft to me, I will do all of the same things I do for medical identity theft and that sort of thing. I'll send a report to the OIG's office for further investigation. But I will absolutely suggest that somebody put those fraud alerts on their accounts, watch their financial information, and report it to law enforcement. Then it's a matter of putting together what we call a case narrative. So I will take all of the details they have provided, write up a narrative about that scenario, that situation, who are the entities involved, so the criminal entities, who's the beneficiary involved, where do they notice that this happened, and then what are the documents that they're able to provide related to their case. I have to do all of that in less than 2,000 words. So that's tricky. And then all of that gets submitted through the SMP information and referral system, so SIRS, which is sort of a separate database than STARS. Some of you have probably heard me talk about it before. It's where I can send these kinds of cases directly, and they go to ACL and then forward it on to OIG. When you guys enter STARS report, you would select send to SMP if you were doing a fraud case, and then it would get dumped into STARS as well. So that would be your route. My route is a little bit more direct. So the final thing I'm going to say is, what do we tell people about protecting themselves? Because if you remember at the beginning, I said we put a huge emphasis on outreach and education around how people can protect themselves. So the number one thing is just don't ever give out your Medicare number except when you are actually seeking healthcare services. If somebody calls you and asks to verify your information, don't give it. Now, if your provider's office calls and they're verifying information because you have a procedure coming up, then sometimes it's a smart idea, if you're not quite familiar with who's calling you, to say, you know, this is a bad time, can I call you back? Get the name of the person, the name of the facility, and a phone number, but then use the internet to look up that facility and see if it matches the phone number. So you get the legitimate phone number off the internet. So that's if you're a little suspicious. Keep all your Medicare, healthcare, and personal information private and only share, again, with known and trusted entities. Suppliers have to be licensed and they have to be verified by Medicare, contracted with Medicare. Same thing with lots of other services. And you can verify that by doing a Google search for the supplier's name and where they're out of. You can do what's called a known provider ID lookup, NPI lookup, and that will tell you the address of the provider. But you can also look up the provider or supplier's name and with a search that says Medicare contract, and it will show often if it's listed with Medicare. And then check health insurance and insurance statements frequently. The other thing I ask volunteers to help with, and this is something anybody can do, you don't have to have SMP training to do this. Teach people how to check their MSNs and EOBs. One of the things I included as far as materials that Noreen's got is a 2-pager on how to read your MSN and your EOB. And you can hand that out like candy to everybody you counsel. It's a really good practice, right? I mean, the same as we would advise people to check your credit card statement or your bank statement. The sooner you catch fraudulent activity, the easier it is to deal with. And then call us, call SMP if there's questions or concerns. And I would even say those of you that are volunteers or, you know, sponsor agencies, VCs, if you're not quite sure about how to share this kind of information with people you work with, send me an email or call me, and I'll take some time to meet with you and talk to you about it. And the last thing I'm going to buzz through, and then my last slide just has, thanks, Nancy. I'm going to get to the last slide, which has our phone number and web link for all of you and for the public. But one quick thing, and you're going to hear more about this over the next month. June is Fraud Prevention Month in the state of Washington. So nationally, they do Fraud Prevention Week, which is always the week of usually it's the 2nd through the 8th of June. We do it for a whole month. So this is a campaign where we really emphasize how to protect your information, how to detect fraud if it occurs, and where to report it. And so we will be planning some articles, some social media posts. I think we'll be doing a podcast or two. So we'll be having all kinds of activities out there. So watch for that. And I will have some asks for all of you out in your communities to help promote this. We'll be sending some things out that you can hand out to beneficiaries and to members of the public to help inform them around this kind of topic. And one more slide. There's my email and my phone number. And then for reporting fraud, we do actually have an online fraud report form on the OIC website. It's super easy to fill out. It's actually my preferred way that people report because it asks enough questions, then I get enough details and enough information to kind of assess the case before I make a call to the beneficiary. And then our SHIBA phone number, of course, is also just fine for calling. All right. And that's my dog and pony show today. What questions?
Thanks, Kim. In the chat, Connie asked if you have a link to the documents. Connie, I think you were probably referring to the one to hand out, right, about the summary of benefits or reading your benefits.
The one that we can
Your
hand
billing?
out like candy.
Yeah, the one yeah, that one.
I'm going to go
Check
print
your
50.
bill.
I'm going to give them to everybody I know.
Perfect. I think Noreen will be sending all of that out after this. Correct, Noreen?
Yeah, and is that posted on the website also, that we can do a link that they can print on demand?
I'll have to go back and look because they just did all of this website renewal. So I have to go back and see what current materials we have available. You're thinking through my SHIBA, right?
Mm-hmm.
Yeah, I will go back and check and see if it's there. It used to be there, but I don't know if it's still there.
But I will be sending it out so that you'll have it that you can save it on your computer.
Any encounters any of you have had with fraud? Lou, I know you and I worked together a bit on a case. If you wanted to share, with folks about that.
Sure. Yeah, I got a call from a referral for this 82-year-old woman who fortunately was pretty sharp. She informed me that she had gotten a call from a supply house asking her for her Medicare number and information. And she said she suspected fraud and hung up. And then short period of time later, a package appeared at her doorstep with various kinds of braces and that type of stuff. I suggested to her initially to contact the doctor's office, didn't think it had come from them, but just to make sure, which she did, and it had not. And then I suggested to her that if there's a phone number on the packing slip, to call them and to tell them to take it back and where it could be sent to. And it was a non-working number. At that point, I got hold of you, Kim, because that was pretty clearly fraud. She also got a second package a few days later. On her behalf, with her permission, I contacted Medicare and put in a fraud report. They looked back at their records and they found that there was a billing from yet another supply house. I mean, maybe these are all just DBAs doing business as, I don't know. So my guess is she probably did give out her Medicare number, although she claims she didn't, but who knows? Anyways, we got the packing slips from her, and the last I had heard is you were going to get hold of her to see if she was getting any EOBs on it, but I think probably the better source for that is Medicare. But anyway.
Yeah, and I did leave a message. I'm hoping I'll be able to connect with her sometime this week. I did leave her a message because she didn't answer. So here's a couple of things. There are people, plenty of beneficiaries that see these claims. They've never given out their Medicare ID. So remember how I explained with provider fraud? Like there can be people in different offices. They can be in pharmacies. Different provider services of all different kinds of healthcare have access to databases. That's how when you go to the doctor's office, they can look up your insurance information, right? And there are less than ethical people that have access to those things and may steal those pieces of information and sell them. In fact, there was a study done a couple of years ago where they saw that, and I don't remember what the percentage was, but there was a large percentage of people that had access to this database that were stealing people's PHI and PII, selling it to the tune of 20, 30, 40,000 names to criminals over the course of a weekend. They're selling that many different people's information. which is scary, right? That's a whole lot of people whose lives are impacted by the sale of their personal information. And that individual selling it is making money to do that. And we, to my knowledge, we don't have a super great system for tracking these things down. And it happens in the what they call the dark web. So it just kind of happens where it's not easily identifiable. Nancy.
I wondered if you could give us a guideline on what dollar amount of fraud triggers a full investigation. And I'm asking because I didn't deal with this SHIBA client myself, but Bob, who I don't think is on this call here on the peninsula, did. And this lady's good health, probably about 67 years old, and she noticed on her MSN reports, all of a suddenly she was being billed for urology catheters. And this happened over many months, and she reported it right away, and it kept going on. And so I think the final amount before it finally stopped was over $20,000 worth. And so I just wondered what dollar amount of fraud really gets Medicare's attention to go after these people.
Right. And that's a tough question for me to answer, because the OIG's office, who ultimately investigates these things, is very close-lipped. They're very, they keep it all very tight to the chest. So they don't really tell us that do this kind of work what the threshold is. Here's what I think we need to remember is they're looking at these things big picture. So if you look at it at the beneficiary level, it has a long-term effect to the beneficiary in that these things are on their account. But 9 times out of 10, they won't ever have to pay for it, because even if Medicare only pays partially and they say the beneficiary has, the amount they might have to pay is XYZ, it's a fraudulent company. So the fraudulent company is not interested in billing the consumer because they know they won't get any money. They're only interested in getting the money from Medicare because it's a slam dunk, right? It's a sure thing for them.
Right.
So when the OIG's office is looking at these cases, they're looking at who are the repeat offenders here? What are the supply companies or entities that we see doing this frequently that we need to go after? So they're kind of casting a broad net as opposed to, going after the one-off. So that's the first thing I would say. But you're right that, if fraud happens and it's $6,000, probably CMS, OIG, law enforcement, nobody's really going to take the time to chase that down. Keep in mind also when it says, say, $30,000, $20,000 as far as the claim submitted, that's not the amount Medicare paid out.
Right.
So that's a whole different thing.
Right.
So, but some of these cases that they've prosecuted I get reports from the DOJ and I get their updates. And some of these cases that they've prosecuted, these people have been doing this for years. So you're talking about, probably hundreds and hundreds of thousands of dollars at the very, very least, but probably more in the millions that they have gotten away with.
So once that fraud alert is on someone's account, like you said, these charges, if they're held against that person in the future when they need services, and all of a sudden their Medicare account says, no, you spent too much, you can't get any more. Once a fraud alert is put on there, does it help protect them from that kind of thing in the future?
Not necessarily, but that's our hope. Asking people to request that Medicare put a fraud alert on their account is more of a recent thing that we've started doing. Same thing. As soon as there is a fraudulent claim submitted, I tell people to request a new Medicare ID. Now, it used to be, say, 5 years ago, whatever, if you asked for a new ID, Medicare would just flat out say no, regardless. Now they are issuing them, but there has to be a fraudulent claim first.
Okay.
So that's the other thing. And kind of back to Lou's case, and one of the reasons I have to kind of circle back with his client is that we need those MFNs to show the fraudulent claim. So even though she got the packing slip, that only means she received the items.
Yeah.
So the documentation they're looking for is, just like you said, a fraudulent claim, how much Medicare paid for it, that kind of thing. Usually I'll ask for things like date of birth, Medicare ID number, because that also helps the investigators to search her account and see if there are other things there that would help them. So good question. So anybody else?
Yeah, Kim? This
Yeah,
is Connie.
Connie.
So this is Connie, and I just
Yeah.
do have a question. I was very interested if you are getting, I'm just thinking about old people because I am one, and we're very protective of our credit rating and all this other stuff. We're mortally afraid that's going to get screwed up. So, if you have a fraudulent claim and they start to bill you for these fraudulent activities, I would be very nervous telling people, well, just don't pay that damn bill because it's wrong. So maybe, is there some kind of documentation or some kind of something they can get in writing that says, yeah, don't pay these bills? I mean, you know what I mean?
No.
What would you say for a reasonable, bright person like myself, if I started to get fraudulent claims and I had filed with you and talked to all the right people, and I was getting billed for money from this fraudster, what is the piece of documentation that I should have that is going to tell me this absolutely is fraud and don't pay this bill?
You're not going to have a piece of documentation. And there's two things there, right? So just because a claim is submitted and it says that the beneficiary might owe this amount, it's not a bill, right? So it doesn't mean you have to pay that, because a Medicare summary notice or explanation of benefits is just an itemized statement. It's not a bill. So that tells you what you might get billed. It doesn't tell you have to pay it.
So in other words, if I let me interrupt here. So in other words, in any normal claim, they file a claim and then whoever pays it is processing that. And while that's being processed, because I get these all the time from my provider, my Advantage plan, they say, this is in process. And so until they have finished submitting it to the insurance company and gotten a response, then the bill is not a bill. And if it becomes a bill, then you're kind of stuck until somebody can fix it, right?
Right. Until you actually get a bill statement from that provider's office, whether it's a supplier, doctor, lab, whoever it is, unless you get an actual bill, that insurance statement is not telling you to pay anything. It's just telling you what you might be responsible for. And then it is up to the provider's office to send you a statement for what your portion is, what you owe. Now, again, I go back to, if it is fraud, most of the time it's a fraudulent entity. In other words, the person committing the fraud knows they're committing fraud. So they're not going to issue you a bill because, number one, you're not going to pay it. And number two, that brings attention to them that they don't want. They want to be able to just continue to send these claims to Medicare or whatever insurance company, because they know they'll get paid by them. But if they try and bill you and you say, I'm not paying this, that makes their life more difficult, and it draws attention to them that they might not want. So I can honestly say, in the past 18 months, I have not had one single case where a person has received a legitimate bill.
So it's checking the legitimate, that you actually have an actual bill that somebody is asking you to pay, and then as a backstop, you can look up that supplier, provider, wherever, and see if they have any standing. Thank you.
Yeah, or give them a call. So like in Lou's case, right? He and the client called the phone number provided on that packing slip of who the supplier said they were, and it didn't go anywhere. And an awful lot of the time, and I had one today, excuse me, I called the supply company, the number they had listed, and it actually went to a phlebotomy lab. So what they did is they stole a different company's number, but it was easy to determine, right? Because I was calling for one thing and it went to a different thing. And the person that answered actually said, did you get notice on your EOB? And I said, yeah. And she said, that company is defrauding people and they're using our phone number and our information to do it.
Okay,
So usually if you follow the trail, it comes up as pretty obvious fraud. If not, that's, Connie, when I say call the provider's number and verify that this is or isn't a mistake.
got it. Thank you.
Yeah. Tina.
Are you seeing any the incidence of fraud, like say this medical equipment kind of fraud, different between people using original Medicare versus Advantage plans?
Yes. So here's what the Advantage plans are doing really well. Whether you like Advantage plans or not, they have figured out how to set up algorithms in their processing systems to catch potential fraud before it gets all the way processed. Now, it's not 100%, right? We're humans, we create things and they're not perfect. But most of the time, they are catching fraud before they have paid out. So my hope is, fingers crossed, CMS, the Medicare system, will take that as an example of best practice and implement something in the future. Because if they can catch a lot of these before they're paid out, then that's right. That would save a lot of agony for most everybody. Yeah.
Now I have to just say, of course, except for the fraud they commit themselves.
Yeah.
So the stuff from
Well,
Wall Street.
well, I mean, that's another topic for another
about where
day.
they send their home health nurses out and they diagnose people with diabetic retinopathy when they're not diabetic. So they can add another $3,000 charge to extort from the government. That just makes me absolutely furious.
I
So
know.
they're committing fraud. They ought to know how to detect and prevent it. So yeah.
I see we're right at 12:04. I want to make sure I'm being respectful of people's time. So I will stay on if there are any questions, but you guys wrap up at noon usually, right?
Mhm.
Yeah.
Thanks so much. Great talk.
Thanks, Nancy.
Yeah,
Thanks, Tina.
thank you.
Thanks very much.
Absolutely.
You guys are awesome. Thanks a lot.
Thanks, Connie.
Funny.
I'm gonna paper the world with that handout.
Perfect.
Right? No.
Hi, Mike.